ITMIG is the International Thymic Malignancy Interest Group. It was established approximately in 2009 and is having its 10th international meeting in Toronto, or just outside Toronto, later this year. Its aim was to do exactly as I said earlier on, was to try and establish working protocols that give the patients the best advice at the end of the day, give the best access to surgery, best access to radiotherapy where appropriate, best access to chemotherapy, and to enrol in research projects so that we can make the good results even better. In terms of the vision that individual clinicians have, whether they're surgeons or oncologists, the care is of the highest. However, it is at the expense of doing perhaps one individual might do 1 or 2 a year. So comparing with the rest of the world, such as Asia, Korea, Japan, China, and more close to home, France, they have got a fantastic multidisciplinary network of regional units that all feed into 1 or 2, I hesitate to use the word centre of excellence, but that is where all the patients are dealt with and then repatriated. So we're a bit behind the curve in terms of that, but that's what we, over the course of the next 12 months, want to establish a number of regional groups that will feed into one central group, whether we call it the UK Thymic Malignancy Interest Group, but we want it to be under the badge of BTOG, under the umbrella of BTOG, which is a fantastic organisation. It is up to me and through my patient advocacy groups, of which I'm wearing one of the badge of the British ones, is to come up with a directory of people with special interests that patients might want to approach in the first instance through their referring physicians or their GP if there is not immediate local expertise. So we'll put our names out there in the public domain and hope that someone will contact us. Regrettably, there is very little research. There's a lot of, in lung cancer, breast cancer, there are lots of trials in immunotherapy, chemotherapy, other agents. It is exciting because new techniques of immunotherapy being used in lung cancer might be appropriate in thymic tumours as well, but we're just not there yet. That's why we need not just national but international cooperation to get these things off the ground.